to get started. Thank you all for joining today. My name is Isaac Reichman. I am the Director of Public Information at the City of Chicago Department of Business Affairs and Consumer Protection, BACP. Today's webinar is an overview of Chicago's reopening plan, specifically focusing in on personal services. I assume everyone can hear me okay, but if possible, can you just chime in on the chat to confirm that I am coming through loud and clear? Great. Looks like we got some confirmation, so that's great to hear. We'll get started. Before I start this webinar, I do want to quickly address everything that's been going on in Chicago this weekend and how it's been impacting our businesses. So first of all, let me just say, before getting into reopening and the real content of this webinar, I want to echo the mayor, the police chief, my boss, Commissioner Rose Escareno, and their message, about the priority of health and safety of our community and our businesses right now. So we just want to make sure that our businesses have the resources they need, particularly regarding emergency cleanup, board up, services like that. So we do want to make sure that businesses know that they can contact 311 or they can reach out to their local chamber if they are in any need of support specifically related to cleanup, board up services, things like that. For immediate life-threatening emergencies, we obviously recommend that you reach out to an emergency department. Reach out to 911 for that. But we've activated a direct line of communication with our local chambers to address other issues at commercial corridors around the city. So we ask that you please do reach out directly to your chamber. And if you're looking for a list of chambers, and I'm going to put it in the chat right now, you can visit chicago.gov/NBDC. There you'll find a list of 70 different community organizations that we partner with, that we're working very, very closely with, contacting all of them multiple times each day to make sure we're addressing needs as soon as possible. So just want to make sure, before we get into the content of this webinar, want to make sure that we are making sure that you guys know that this resource is available. So if you're in need of cleanup, board up services, have questions, anything related to this that isn't a life-threatening emergency, please reach out to your local chamber or please call 311. Additionally, I'm sure folks have questions about how the current situation, the current crisis we have going on, how that impacts the reopening. So as you know, we are planning on shifting from phase 2, stay at home, into phase 3, cautiously reopening, this Wednesday, June 3rd. That's the plan that the mayor announced last week. And for now, that is still the plan. We want businesses to prepare for reopening, for the reopening date to be June 3rd. Now, the mayor and the health commissioner have been very clear, however, that this is a minute-by-minute evaluation. And we may be pushing back that reopening date based on the emergency, based on where we are at with the current situation, and also based on the health risk. So we just want to be very, very abundantly clear. June 3rd is the date that you should still be tracking towards, but we may be changing that, and we will be communicating that change as soon as possible to our business community. And by attending this webinar, you are on our distribution list if you weren't already. So we will be making sure that you get that communication as soon as possible. So a little bit of housekeeping before I get into it. If you all should be on mute, you join on mute automatically, so there shouldn't be any issues there. If you have any questions over the course of this presentation, I ask you to submit those questions via the chat function. There are two different ways to submit questions, the chat and the Q&A. It's challenging for me to monitor two different sources, so the best way to submit questions is to submit them via the chat function. If you submit them through the Q&A, I will not see them. So again, please use the chat function if you have any questions. Additionally, we will have an email that'll be on every slide other than these opening slides that will give you the that'll show you the email address that you can reach out to if you have any follow-up questions. I'm going to type that email address into the chat to make sure that you have it, because I will do my best to answer questions as they come up over the course of this webinar. But we have a high number of attendees, and I may not be able to answer every single question. So if I don't get to your question, please submit it to bacpoutreach@cityofchicago.org. Again, I'll be repeating that email throughout this presentation. We will work to get you a response to your questions, typically within a day. So without further ado, I'm going to jump into the webinar. So the agenda for today, we're focusing on the entrance into phase 2 that is called cautiously reopening. We're specifically focusing today on personal services, hair salons, nail salons, massage establishments, etc. I'm going to go into a little detail on what exactly falls into this personal services category. So today I'm going to talk about the overview of phase 3 and the criteria and why our health department deems us ready on June 3rd, again, pending the progress on our current crisis going on, to make sure that we are ready, why we are ready to enter on June 3rd. I'm going to talk in detail about the reopening guidance specifically for personal services. As you know, hair salons, nail salons, massage establishments, etc., are very much looking forward to reopening as soon as possible. We want to make sure that you're doing it safely. We know that everybody wants to reopen safely. We know that everybody wants a haircut right now. And we want to make sure that doing so doesn't lead to an increase in COVID-19 cases. Because if that were to happen, Health Department and the mayor have been clear. We are prepared to move back into phase 2 if needed. I'm also going to talk about reopening resources, other things you can find on our reopening website that will help you out during this time. Finally, I'm going to talk just a little bit about enforcement and operational requirements. So first, I want to talk about the whole Protecting Chicago framework. This framework is the basis that the city is using and our health department is using to slowly reopen the city. And the mayor has been abundantly clear since the beginning of this conversation, and I want to reiterate it right now. We are not flipping a switch on June 3rd. We are rather turning a dimmer. We are cautiously reopening. So the health metrics have made it clear that we can begin thoughtfully and cautiously reopening Chicago in a safe and responsible manner, with strict physical distancing in place. So what exactly does that mean for Chicago? Before I get into personal services, I'm going to talk about the whole phase 3 as a whole. So non-essential workers that previously were closed can begin to return to work in a phased way. We predict about 130,000 workers that were previously not working coming back to work during this phase. So certain businesses, nonprofits, city entities can open that were previously closed with appropriate protections for workers and customers. And I'm going to go into detail on what exactly that means. So what does this mean for your personal life? You can begin to now have more interactions with others. But when you meet others, you should still be physically distancing, and you should be wearing a face covering. That face covering requirement will not change during phase 3. You should also be limiting social gatherings to 10 or fewer people. You'll hear me repeat this throughout this presentation. Social gatherings should be limited to 10 or fewer people. And physical distancing should be maintained at 6 feet. Those are your two real magic numbers under phase 3. Social gatherings of fewer than 10 people, physically distancing 6 feet. Public amenities will begin to reopen under phase 3, but not reopening in full. Then finally, I want to talk a little bit more about health, because this is everything we're doing here is related to the health of our residents. The reason why we're ready for phase 3 is because the health metrics tell us that we're ready for phase 3. The mayor didn't arbitrarily choose June 3rd just by looking at a calendar. That date is very specifically chosen due to the health metrics telling us that is the right date for Chicago. But that does not mean that we're out of this crisis. That does not mean that COVID-19 is not something that we need to worry about. In fact, you should be still keeping this at top of your mind. You should be staying home if you are sick or if you've been in contact with someone with COVID-19. That is not changing, and that will not change for a long time. If you feel sick, you should be staying home. That is period, end of conversation on that. We have an anti-retaliation ordinance that we just passed that the Director of Labor Standards will actually be going into more detail with on tomorrow on a webinar. But that basically protects workers that says if you are staying home because you are sick with COVID-19, you cannot be fired and you cannot be retaliated against. We're doing everything we can to make sure that workers, that Chicago residents are able to stay home when they're sick. You should also be physically distancing from everyone, particularly vulnerable populations. People that are elderly or people with underlying health conditions. Please, if you live with somebody, even if you are young and healthy, if you live with somebody who's sick, you should be taking extra precautions. Finally, you should be getting tested if you have symptoms. We are and I'll talk about it a little bit more in the next slide. We've very much ramped up our testing, and we're able to test, over 5,000 Chicagoans every day. If you have symptoms, you should be tested, even if you do not have underlying health conditions, even if you're in a safe environment. You should be tested if you have symptoms. So with all that, why are we ready for phase 3? Again, this is pending some additional decisions that will be made by the mayor and our health commission. But for now, we are ready to transition to phase 3, and businesses should prepare for that date of transition to be June 3rd. So again, as I said, we're not arbitrarily choosing this date. We established over a month ago a series of criteria that we would use to determine when we were ready to shift from stay at home to cautiously reopening. We needed a declining case incidence and a declining percent of positivity with our testing. So we want to test a stable, regular amount of people, and we want our percent positive to be going down. And we want our total cases to be going down. And they are. Now, we still have more progress to be made, but that is the case. We're also seeing declining rates of hospitalization, ICU admission, and death. That's ultimately what we are trying to avoid here. So the declining rates of that are a very good sign. One thing that we are looking at too is the proportion of emergency department visits that are for influenza-like illnesses. We're actually making advanced progress there. That's something we track every year, not just during COVID-19. We are seeing a decline in the proportion of emergency department visits that are for those reasons. One thing that we've actually been doing a very good job of throughout this crisis is having adequate hospital capacity. This is basically ensuring that we have enough hospital beds, ICU beds, and ventilators. So if we were to ever see a significant spike like some other cities saw, will we be prepared? And the fact is we have been this entire time, and we still are. One thing we're looking at is adequate testing capacity. Without adequate testing capacity, we don't know what sort of progress we're making. So we're proud to say that we're performing over 5,000 tests a day in Chicago. And then overall percent positivity tests. We look at two different things. We look at the whole folks in the community, then we look at congregate settings, nursing homes, jails, places where folks are living in congregate. We're looking for under 30% positive tests in congregate settings and under 15% positive tests in community settings. And the data shows that because of this, we're ready to move to phase 3. Finally, and this is very important going into the future, we want an expanded system in place for congregate and community investigations and contact tracing. The mayor announced a plan last week for having that expanded system in place. So the reason why I wanted to lead with all this is it is essential and critical for this entire conversation to be couched in health terms. We need to be focusing on the health reasons for everything that we do. That is our North Star. That is our guidance throughout this crisis and into the future. So I'm not the health expert, so I'll do my best to answer a couple of the health questions that are coming in. But we will be, I just want to make sure that this is the lead of this conversation. Everything we're doing is for health reasons. So let me, so as I see a couple health questions come in, the city of Chicago does have a list of COVID-19 testing sites. You can find more information about that at chicago.gov/coronavirus. And there's more information too there that'll help you understand if you should be tested. So please visit chicago.gov/coronavirus for all of that information. So now I wanted to talk a little bit, sorry about that. I wanted to talk a little bit about the sectors that will be reopening in phase 3. All of these sectors have specific guidelines that have been released and that you can find on the website, chicago.gov/reopening. Let me type that into the chat as well. If you haven't visited this site, I recommend that you do so as soon as possible. So what will be reopening under phase 3? Again, reopening cautiously with specific guidelines in place in order to ensure safety of our community into the future. Childcare will be reopening, childcare centers and family childcare. And you can find the guidelines for childcare, including home daycare, on our website. City services will be reopening in phase 3. As the mayor announced, city services will be opening on June 8th, not on June 3rd. This includes the park, but not the lakefront. The lakefront will not be opening immediately. It also does not include contact sports. The libraries are also set to reopen on June 8th is the plan for now. Office-based jobs can reopen, professional services and real estate services, hotel and lodging, and outdoor attractions like boating, not including the playpen, and also golf courses, not including those on the lakefront. Retail can reopen, health and fitness, retail stores, and personal services, hair, nail salons, barbershops, tattoo parlors, massage establishments. They can reopen under phase 3 as of now on June 3rd. And I'm going to go into more detail, as you can see, on personal services today. And then restaurants and coffee shops can reopen for outdoor dining and drinking only. So, what do I mean by personal services? I got a question if daycare counts under personal services. No, daycare is its separate industry, and there's separate specific guidelines on chicago.gov/reopening. So here's a list of example of industries that are included in personal services. This is not an exhaustive list. Beauty salons, nail salons, tanning salons, day spas, massage parlors, saunas, depilatory and electrolysis salons, any hairstylists, hair replacement or weaving services, barbershops, ear piercing services, tattoo parlors, anything that's kind of related to one-on-one personal services. Skincare, I got a question there. If skincare was not already opened under the healthcare exceptions, they can now reopen under the personal services. So really any sort of one-on-one personal service that was not open previously can reopen now. So one So if you're looking for a little bit of guidance on what exactly is considered personal services, if you are not 100% sure whether your industry is considered under personal services, there's two things you can do. First, one recommendation we're doing is you should be using your own kind of jurisdiction and your own judgment as a you should be using your own judgment as a business owner, whether you exactly to find out what industry you fall in. So that's something that we're not being too prescriptive about. You can also send an email again to BACP Outreach, and I'm typing it in again, at cityofchicago.org. Please send an email there. If I'm unable to answer your question here, we'll make sure to get your question answered. And starting either hopefully today or tomorrow or Wednesday, we're going to be posting a full list of businesses on that chicago.gov/reopening website to provide a little bit more detail. So if you have any questions about whether you would be considered personal services, then please do feel free to reach out to us. Hopefully I'm able to answer those questions during this presentation. If not, please send us an email. So first, let me tell you what you can find on chicago.gov/reopening before I get into the specific guidelines on personal services. You can find, as I said, those industry guidelines for all of the different specific industries. You can also find something that we're calling a self-certification. You can take the Be Safe Chicago Pledge in order to certify that you understand your industry guidelines, and you'll then get something that you can post, that you can print to post at your location. And then finally, there's additional resources. National resources in response to COVID-19, health-focused posters, FAQs, things like that. Great. And we also have, if you have any questions, you can submit them also via the 311 hotline. I'm seeing a couple questions come in. I'm going to do my best to answer them right now regarding what is considered personal services. Again, if you're not 100% sure and I'm unable to answer the question now, I will be able, please submit them via email and we'll follow up with the right folks to get those answers. So one thing, and I'm going to talk about this a little bit, if the service requires a mask to be removed, then it cannot be reopening and it cannot be performed. Only services that can be done while a mask is still on. So while hair salons and barbers can reopen, they cannot do beard shaves, things like that. So you can reopen, you just can't do something that requires a mask to be taken off. Waxing centers would fall under personal services and can reopen. And I'm seeing a couple questions come in related to specifics about gloves, masks, and things like that. We will be covering that in detail on the coming slides. So if I don't, if I do not get to them, then please then follow up with the question. And let me type in this website again. Great. I'm seeing a question, are accountants and attorneys considered personal services? No, they are not. They're considered professional services, and you should be checking out the specific guidance we have kind of for commercial buildings, which I'm doing a training on Thursday for. A question about beards and facials. We do not have a date for when they will be allowed. That will be something that we will be sharing as soon as it is ready. Saw a question about the self-certification. That is live now. When it was initially posted, I believe it didn't go live until last Thursday, but now you can go online and take that self-certification. Great. So all the guidelines on the chicago.gov/reopening website, they're split up into 3 categories within those guidelines. Information about healthy interactions, safe spaces and conditions, and operational resilience and monitoring. So under healthy interactions, we'll have descriptions on how you can maintain social distancing and how you can limit your gathering size. As a reminder, the magic number for social distancing is 6 feet, and the magic number for a gathering size is 10 people. We also talk about protective gear. Every single industry across the board is required to wear masks in some capacity. There are specific additional guidelines for personal services that I will get into. Also, safe spaces and conditions. Every industry across the board is required to do some sort of self-screening of employees at the beginning of shifts. Let me make a point about that, though. That is just self-screening. You are not required in personal services. You are not required to use to do a temperature check at the beginning of every shift. At minimum, you are required to have employees ask themselves a series of questions to self-screen themselves and to make sure that they are healthy and able to work that day. You know, you are allowed as an employee to do more than that, to have the employee ask the questions themselves or to have a temperature check. But the only minimum requirement is a self-screen. And there's information on the guidelines about what sort of questions should be asked there. It's also information about cleaning standards, visual guidance, and workplace conditions. And also on operational resilience and monitoring, how you can keep your employees and customers safe into the future. All right, so with enough build-up, I'm now going to get into a little bit more detail on personal services and what they will look like. So if you go to chicago.gov/reopening, you'll first see a page that looks kind of like this. And this provides a picture of what you will be expecting and what you will be seeing at personal service locations. So I'm going to leave this up for just a minute before going into all of the details, all of the requirements in details. First, as you can see with number 1 here, workstations may need to be decommissioned to allow for physical distance where necessary. Number 2, sanitizing products should be available for both employees and client use. Number 3, employees should disinfect their stores frequently. Number 4, face coverings should be worn by customers and employees at all times. Additionally, we are recommending face shields and other things like that when services require closer interactions. Customers are encouraged to make reservations. Walk-ins are not allowed. Walk-ins are not allowed to wait inside, for their service. And then, as you can see, visual signage should be posted throughout the establishment. And you can find that signage at our website. So let me go into these in a little bit more detail. Social distancing, again, that magic number is 6 feet between individuals, between close choke points. You know, you should always keep a 6-foot walkway distance, and you should always maintain 6 feet between individuals. So all areas need to allow for 6 feet of social distancing. If you are unable to keep If your workstations are not 6 feet apart, then you should be decommissioning every other workstation. Or if you are unable to have a permeable barrier. So let me take a step back and repeat that again. You need to make sure that there is proper social distancing between your workstations. This can be either maybe they already have workstations, they're already 6 feet apart. That's great. Or you can set up an impermeable barrier between workstations. If you're able to do that, that is also great. If you are unable to do either of those things, however, then you must decommission every other workstation. So if you have workstations that are 3 feet apart and you cannot put up impermeable barriers, then you must decommission every other workstation. And you should also be installing barriers and making any other places where 6 foot distance is not practical, such as checkout counters, things like that. Gathering size. Again, the magic number for gathering size is 10 individuals. You should have no more than, even if you can maintain social distancing, gatherings should have no more than 10 individuals. Break rooms should have no more than 10 individuals gathered closely. Parties coming in, maybe you have a big group coming in together, that group should have no more than 10 people. Additionally, you should be limiting your capacity to 25%, excluding the staff. A really important point on capacity, however, when I say capacity, I mean your capacity based on the occupancy and the square footage of your location. I do not mean capacity based on your how many chairs, for example, you have at your hair salon. So you should be limiting capacity to 25% of how many people could, in a typical time, comfortably fit within your location. Now, I know that most personal services do not have a specific occupancy placard, and that's why this capacity restriction is a guideline that we are giving to businesses in order to use their best judgment for how many folks should be able to come into their business. We're not giving a specific square footage calculation, and we're not giving, folks don't have, again, occupancy placards for this. So we are, though, telling you to limit your capacity to 25% of your typical capacity that could maximum fit within your location. And it's based, again, on your full occupancy of your space, not based on how many clients you would typically have. Happy to answer kind of specific questions if they come in related to capacity, because I know that that is kind of a sticky point and that folks have questions there. You should be ensuring that protective gear is worn by all employees and customers. Face coverings must be worn over the nose and the mouth, although exceptions can be made for people with medical conditions or disabilities. As was talked about earlier, and here it is in writing, any service that requires the removal of a face covering cannot be conducted. Let me repeat that. Facials, shaves, anything that requires a face covering to be removed must be decommissioned. So, a barbershop that specializes in beard shaves, they cannot be doing those beard shaves. That does not mean that they can't open, they just cannot be doing that activity. Because it is very, very critical in personal services when you have a very close contact between folks that you are being cautious. If it is practical, we also are strongly recommending using face shields, goggles, and or gloves in addition to face coverings if your activity requires close contact to guests. If you are within that 6 feet, which you probably are for most personal services, for extended period of time, particularly if you are close to their face, we are strongly recommending face shields, goggles, and or gloves. Again, that is a very strong recommendation, if practical, to be using those. Again, I'm happy to answer questions about the protective gear as they come up. You also should be ensuring hygienic interactions between customers and employees. You should be providing sanitizing products for customer use, ensuring that employees wash hands before and after every service. There's something that can come out of this crisis. It's the real importance of proper hand hygiene. You should be encouraging employees to wash hands before and after every single service. Make sure that sanitizing products are available at all times for customers, for employees. You should also be sanitizing all products after each customer. And you should be eliminating the usage of samples and testers. So no samples, no tests, and sanitize all products after each customer. You should also be encouraging staff to complete COVID-19 health and safety training before returning. You can find more information about this health and safety training on the chicago.gov/reopening website. We don't have one specific training that we are recommending. I know that the World Health Organization has a great training though, and we do recommend folks to check that out. You should be implementing screening measures for employees and customers. Prior to entering establishments, employees should self-screen, as I talked about a little bit earlier, to ensure that they have no symptoms of COVID-19. They should not be reporting or allowed to remain at work if they are exhibiting symptoms or reporting that they feel ill. This is absolutely critical. We are reopening, but it is not a free-for-all. If you are sick, you should be staying home. On the guidelines that you'll find at the chicago.gov/reopening, you will find information on that self-screen. What businesses should be asking, what employees should be asking themselves before they enter the work site. They should be basically assessing themselves to make sure that they do not have a fever, that they do not have a cough or a sore throat or something like that that's worse than the day before. Things like that. So, you also should be posting a pledge upon the entrance or conducting a screening to verify that customers or contractors, external suppliers, something like that, are not currently exhibiting COVID-19 symptoms. So you're not expected, to do a temperature check of every customer that walks in, but you should have a pledge upon entrance saying, do not enter if you are experiencing symptoms. You should be establishing daily cleaning standards for spaces and high-touch items. Disinfect high-touch areas with an EPA-registered disinfectant. More information can be found on our website. After each customer. This is not something you should just be doing once a day. This should be after each customer. High-touch surfaces, doors, handles, reception stations, etc., should be sanitized throughout the day at least every 2 hours. Should also disinfect and sanitize all equipment after each client. You should minimize sharing of tools and equipment between staff, and if possible, we know this isn't possible for everybody, you should be using disposable equipment. You should also be providing visual guidance on hygiene standards and entry requirements. There is guidance and criteria that you should be posting, which you can find on our website, and that is stuff that you do need to post to make sure that everybody is aware of the different rules. You should also be optimizing ventilation and airflow. If possible, you should open windows. You should look at your HVAC system and see how you can improve airflow. This is critical. The CDC guidelines have shown that proper airflow can really help with the transmission of this disease. Great, and I believe this is our last slide on details. So I see a couple questions coming in, and I will handle those questions after this slide. You should be limiting your in-person work where possible. Now, obviously, for nail salons, that needs to be done in person. You can't do personal service work without being in person. But you should be thinking as an employer, when can I limit in-person work? When could I do staff meetings virtually instead of in person? Can I do online trainings instead of in-person trainings? Really be thinking about how you can minimize in-person interactions, with the understanding that obviously with personal services, you can't totally get rid of them, but what can you do? You should also be limiting interactions between individuals. As we said at the beginning, you should not be you should be strongly recommending appointments, and in-person walk-ins should not be allowed to wait inside within the same area. So really, you should be doing appointments to make sure that you're minimizing interactions between individuals. You also should be minimizing client overlaps. You should really just have one client per employee without overlap in clients. And I think the reason for that is pretty obvious. We do want to make sure that you're not transmitting something between different clients, that you're taking that time between clients to disinfect, to wash your hands, to sanitize. You should not be having multiple clients per employees. And again, as I said, walk-ins are not allowed to wait for appointments inside the establishment. Finally, you should limit travel for businesses. Many of you might have multiple locations at which you operate. you should really be making sure that your staff are staying at just the same location. As the health study of this disease has shown, the more we can minimize interactions, the more we can minimize travel and minimize the amount of different people and different things that people are interacting with, the better this will be for the entire health of our community. Finally, you should be following CDPH and CDC guidelines for testing and tracing protocols. You can find in the guidelines a link for CDC guidelines on what exactly you should do if an employee does contract COVID-19 and how you should disinfect the workplace. And folks that have had close contact with this coworker should be self-quarantining. If a facility becomes aware of 2 or more cases over 14 days, you are required to report that to CDPH. And then finally, and this is something specific for personal services, so I want to make sure we're clear here. For each customer, you should keep a log of the name, contact information, and the service provider for at least 60 days following the service. Let me repeat. Personal services are required to keep logs of the name and the contact information for their clients. And what's the reason for this? Hopefully, again, this is pretty obvious. The health department has been very clear about the importance of contact tracing. For us to really be able to fully reopen and really be able to hit phase 4, phase 5, and then be out of this, we need to be able to trace the disease. We need to be able to do contact tracing. And this is absolutely critical for us to be able to do that. So before I get in, I do have a little bit more at the end. I wanted to open it up. I saw some questions come in. I want to make sure that I am able to use these to answer these questions. And let me type in, again, the email. If some questions, I just do want to be clear. I know a lot of this content and will do my best to answer as many questions as I can. Some of them, though, might be questions that either I'm not the expert on or I'll need to check in with our committee that's reviewing these things daily. So if I am unable to answer your question, either because there were too many coming in or I do not know the answer at this point, please send an email to BACP Outreach and I will be, should be getting your response within 1 day. So let me take a minute to pull open chat. So when I state walk-ins, so as I said, walk-ins are not allowed to wait for appointments in establishments. So let me clarify a little bit. I don't believe I have said, and I apologize if this was unclear, I'm not saying that walk-ins are not allowed. We are saying that walk-ins should not be waiting for their appointment in the establishment. So you can have walk-ins if there's some way for them to be waiting outside of the establishment. You know, someone could walk in and make an appointment for 5 minutes later and then walk back out and then come back 5 minutes later. That can be okay. So we're not saying no walk-ins. We're saying walk-ins cannot wait for appointments inside the establishment, and we are strongly recommending appointments. So you really should, if practical, implement an appointment-only model. Now, that is just a strong recommendation. That's not a requirement, but we do strongly recommend appointment-only models. Great. I asked, are single-use changing rooms allowed to be used for clients? Yes, that is something that is allowed. We do, you know, please do follow the sanitizing, disinfecting requirements, and please make sure that, you know, any robes or gowns that clients are using, that they're washed before then someone else is using them. I saw a question about the previous stay-at-home order suggested 50% of capacity. Why are we lowering the capacity here? Let me provide a little bit clarification on that. The previous stay-at-home order suggested 50% capacity for retail stores. However, personal services are very different than retail stores. Great. Yeah, personal services are very different than retail stores. So that we're saying 25% capacity for personal services. And part of the reason for that is, as I said at the beginning, this is a dimmer switch. This is not flipping a light switch. Personal services have not been open now for 2.5 months, and we want to slowly ramp up. We do not want to immediately go back to what we are. So to clarify a point, while retail can open with 50%, grocery stores, hardware stores, things like that, retail that was previously considered non-essential is also only opening at 25% capacity. So your clothing shops, for example, are only opening at 25% capacity. A couple questions. How long can clients wait in between booked services for nail drying, etc.? Now, we do not have specific recommendations about that. We ask, however, that you take into account all of the guidance that you find here to make sure that folks are in a sanitized location and 6 feet away from people. That 6 feet measure, that is really measured. There isn't going to be a ruler kind of taken out for all this. That is between workstations. You should have 6 feet. Let me scroll through. Yes, so there was a question about self-screening, what you should ask the clients versus what you should ask the employees. Let me move back a slide for a little bit about this. So the self-screening questions, to clarify, and that's a great question, the self-screening questions are specifically for your employees. These are questions that the employee should at minimum ask themselves, and you as the employer should be sharing those questions with the employees. We also are, if employees want to ask those questions, if employers want to ask the questions to their workers, they can. There is not a specific set of questions that should be asked to clients. However, we are asking that you post some sort of pledge upon your entrance that customers are aware that they should not be entering with COVID-19 symptoms. Great question. Where can I call to report a salon that is already open and doing violation? So we actually have a number of our investigators on the line today, and BACP's investigators have been doing an incredibly great job enforcing the stay-at-home order. So you can call 311 to report a salon that is already open. And that's an important part of clarification. The governor's stay-at-home order, as you might know, ended on Friday, May 29th. However, we are not ready to enter into phase 3 until this Wednesday. So there is a temporary public health order in place right now that is basically extending the governor's stay-at-home order into until June 3rd. So please do call 311 for anybody that is violating. We know the vast majority of businesses want to do the right thing, and we want to make sure that that is the case. The health of our community really does depend on it. One question now, I think that kind of leads into a good question about enforcement. So as you know, and as I've talked about, these are our guidelines. And a lot of things in these guidelines are, include language where practical, things like that. But that doesn't mean, but let me clarify, some portions of this guidelines will be enforceable. When we hit June 3rd, that social distancing requirement of 6 feet, that is an actual requirement that businesses are required to follow. That is not a suggestion. The gathering restriction, that is not a suggestion. That is absolutely a restriction, a requirement that is going to be a requirement across the board, across the city of Chicago. So please do read the guidelines closely. There are obvious places where we say, hey, if possible, do this, where practical, do this. There are other times where, that 6 foot social distancing, for example, absolutely essential. I saw some questions about massage services, massage establishments, and that is a point of clarification that I did not make. Thank you. Massage services from the state level have been limited to 30-minute sessions. So what is to stop an individual from booking more than one 30-minute session back to back? This is where we're relying on businesses. These are what businesses need to do to stay safe. And businesses should not be booking 30-minute sessions with the same client back to back. And You know, this is all about businesses that want to do the right thing and now have the guidelines for which for now that they can do the right thing. So it's really incumbent upon the business to make sure that 30-minute sessions are not conducted back to back. Okay. I'm seeing a couple questions come through about how this might be different in phase 4 and phase 5, what might be changing halfway through phase 3. What I will say is we will be communicating these requirements as soon as possible. We are working tirelessly to get these guidelines up and to make a plan for phase 4 and a plan for phase 5. You know, we are sharing everything that we possibly can. We know that that answer is not good enough for a lot of businesses, but I promise that we will be doing so as soon as possible. Okay. I saw a question, what is the reason for the 30-minute sessions? I cannot speak too much about the reason. To clarify, this is 30-minute maximum for massages. That is a specific requirement just for massages. And that is something that has come from the state level. It's not come from the city. So unfortunately, I'm not the health expert, so I can't speak too much to this other than to say, you know, when you are in close proximity, the longer you are in close proximity, the better chance that the disease is transferred. So that's kind of the intention there. Okay. One point, and this is a great question. Question just came through, 10 people in the beauty salon. Does that include the beauticians? Let me make a point about what the requirements are around the number of people in a location, because I think this is an important point of clarification. The limit on number of people within a location is 25% of the capacity. So basically take your location, how many people would you maximum feel comfortable with during a typical time, and now go down to 25% of that. That 10 people, the restriction on gatherings of 10 or more people, of more than 10 people, sorry, that is an across the board restriction. For parties, for everything in the city will have a restriction of having no more than 10 people within one gathering. However, if you have a large salon that can fit more than 10 people within your 25% capacity and with 6 feet distance between all of them, then you can have more than 10 people. The gathering restriction is I know this is a little confusing. The gathering restriction is for people all gathered together, kind of part of the same party. So if you have folks that want to do, you know, show up to a nail salon all together, you can't have more than 10 people show up at once all together. I hope that makes sense. I know that's a little confusing. I know there's a lot of different numbers around. And we will, I'll provide more clarification if folks have any questions. Please send us an email and I can get you more clarification there. I saw a question come in, what to do, when will clubs reopen? Not sure if you mean nightclubs or social clubs. So if you can provide a little bit of clarification on that, I can try to get you an answer. Okay, before we wrap up, I wanted to talk a little bit about this self-certification pledge that you can take on the chicago.gov/reopening website. You can find this again at chicago.gov/reopening, and you'll be able to print a Be Safe Chicago badge that you can then post on your website. And this is, or sorry, you can then post at your establishment. This will show your customers that you know the rules and know how to be safe. It's also cool, we just added this. You can actually include your neighborhood. You can say, be safe Little Village, be safe Chatham, be safe Lincoln Square, so that you can have a little bit of pride in your neighborhood while doing this. You can find the information for that. You can find the information at chicago.gov/reopen. And finally, something that I want to make sure you're all aware of if you are not already is Chicago's PPE market. We know that it's hard, particularly for small businesses, to get the PPE that they need, the personal protective equipment. So we established, in conjunction with a local startup called Reply, we've established a local PPE market. There's equipment, protective shields, hand sanitizer, face masks, gloves, things like that available for competitive prices for purchase just for Chicago small businesses, CBOs, and nonprofits. So if you haven't checked out this website, which you can find on my slide right now, please do so as soon as possible. So we just got another minute or two. So I'm going to see a couple additional questions have come in. A lot of questions about kind of what's happening next, when nightclubs and bars can open, when massages can last longer than 30 minutes. I know this is not a great answer, but we do not know at this point when that will be. The mayor has made it clear nightclubs, bars, breweries, places like that that don't serve alcohol will not be reopening in phase 3. So nightclubs and bars, things like that, will be opening in not until phase 4. Some other things may be opening in the middle of phase 3, things like museums, youth activities. We'll be sharing this, I promise you, we'll be sharing this as soon as possible. I do wish I can give you a better answer. I know how tough this is for businesses. We will, I do apologize for that. For the certification, that's a great, I was asked, is the certification emailed to you as well? I do not believe so, but I can check with our team and get back to you on that. Please do feel free to send us an email. Got a question, is there a copy, of the text for the customer pledge that we can post? I believe that is on our website, chicago.gov/reopening. If not, please send us an email and I can reach out to our health department to make sure that you get that information. So restrictions for dog groomers. I think this is a great example of an industry that can sort of fit within multiple different guidelines. So I think you need to, for dog groomers, I think you would need to evaluate your industry, exactly your operations, and see if it feels more like retail or it feels more like personal services. If you're having close interactions with people, we do recommend that you follow the personal services guidelines. If you're more in like a general retail, we recommend that you follow the retail guidelines. Great. So it's 4 o'clock. I know I was unable to answer every single question, and I do apologize for that. And I do want to reiterate that obviously with everything going on in our city right now, the priority is safety of our residents. That's the number 1, 2, 3, 4, and 5 priority right now. And we, as the mayor made clear at her press conference this morning, we want businesses to still be operating and preparing for June 3rd as the open date. We will be, she said this is a minute-by-minute decision. We need to see a little bit about how tonight goes and how today goes and how we will. I do not know when the mayor will be making the decision, but I promise you that we will be communicating that out right away. So thank you all for your time. Please do follow up again. I'll type it for the 5th time. Please do follow up if I was unable to answer all of your questions. And I just do want to say, the city, from everybody here at the city, we thank you for your patience, resiliency, and dedication. We know that this has been an incredibly, incredibly challenging time, and we do, wish you all the best of luck in going forward. And we'll be here for you to answer questions, provide guidance, and to assist you going forward. Thank you.